the classes we're going to study in this topic, which is these are the 4 categories we're going to study. One, reduction of gastric acid. So how we're going to reduce the gastric acid? By giving the H2 antagonist, proton pump inhibitor, anticholinergic drug, and one more is there, prostaglandin analog. Okay, so it is mostly given in the cases of NSAID induced ulcers. Next one is neutralization of gastric acid. Okay, so this is another category in which antacid comes, and in that again antacid get divided into 2 categories. One is called as a systemic and another one is non-systemic. Okay, that we're going to talk in the antacid parts. Ulcer protective. So these are the ulcer protective drug which will going to form a layer on the mucus and which will going to prevent the mucus layer damage. Next one is anti-H. pylori drug. So there are a few antibiotic we're going to see in this category which will going to kill the bacteria, and you already learn about the various mechanism through which this antibiotics works, right? So this category we're going to see in detail in this chapter. So first we'll start with the H2 antagonist. You already know about this mechanism, like how H2 antagonist will work by blocking the H2 receptor. How anticholinergic drug will going to work by blocking the muscarinic receptor. How proton pump inhibitor will going to work by blocking the proton pump or inhibiting this enzyme. Okay, so one by one we'll go in detail. Like first drug we're going to talk, which is about the H2 antagonist. Okay, so histamine H2 receptor, which is present in the parietal cell, which is responsible for the acid production, on which this drug will going to act. Okay, so what is the mechanism of action? You already know about it. Histamine. What is the role of histamine in the parietal cell? This histamine will bind on the H2 receptor. Who will going to release the histamine? Which cell? Parietal cell release the histamine or any other cell? H2 receptor is present on the parietal cell. Okay, you can see parietal cell, there is a H2 receptor. But who will going to release the histamine in that area?
Sir, ECL.
Okay, yes, ECL, or we can say oxyntic cells are there. Okay, so that oxyntic cell is also responsible for release of histamine. Okay, so then how they will going to work? What is the mechanism? By increasing the CMP. We already seen the mechanism in that diagram, right? Whole physiology diagram. Okay, then what will happen? They stimulate the sodium potassium pump, and that will going to hydrogen potassium pump, not sodium potassium, and that will release the H plus ion. Okay, so by mistakenly it is sodium. So hydrogen potassium pump they will activate and they will going to release the H plus ion. So that is a normal physiology. So what our drug will going to do? They will bind on this receptor. They will block the H2 receptor. Okay, so mostly this particular treatment is given for the stress related ulcers and the drug related ulcer. Okay, so whenever there is like NSAID related, so in that also we can give the H2 antagonist. Here again you can see these are the various categories, or we can say these are the various drugs from this category: cimetidine, famotidine, roxatidine, ranitidine. So here the first drug from this category was cimetidine. Okay, around 1977 this drug got entered into this category. And another important thing, this whole discussion will revolve around this cimetidine, okay, which is a prototype drug. And then other drugs will follow the same drug, only these drugs are the next generation drugs. So whatever there are few side effects from this cimetidine will get decreased with these drugs. Okay, even some interaction kind of things which get decreased with the other drugs. Okay, so we'll start with the cimetidine, their pharmacological action. So first pharmacological action is their H2 blockage property. So this drug already have very good capacity, or we can say selectivity, high selectivity towards the H2 receptor, and no action on the H1 and H3 receptor. So because of that, this drug is very selective, no other side effects related to the histaminic receptor. Then you can see they also have action on the heart. Okay, so on the heart, what kind of action? Like cardiac stimulation. But these kind of things we have not seen in the human. Okay, so that is mostly seen in the isolated preparation, especially in the guinea pig. Okay, so that can show the cardiac stimulation, but there are some report related to the cardiac stimulation. Then another effect, they also have uterine relaxation, but not in human. So it is seen in the rat muscle, rat uterine muscle, bronchial relaxation, that can seen in the human also, bronchial relaxation. And here you can see they also potentiate the histamine induced bronchial spasm. Okay, means they will block these H2 blockers, will going to potentiate the relaxation over here. They will stop the histamine induce the bronchospasm. As we know in the asthma, histamine is also responsible for the bronchoconstriction. So this blocker will going to have the effect on this H2 histaminic receptor, which is involved in the asthma. Okay, next one is gastric secretion. So as we know, H2 blockage, that will cause decrease in the gastric secretion. How they will going to do that? By blocking the histamine release from the ECL that we already seen. On the ECL also there is a histaminic receptor, and on the parietal cell there is a histaminic receptor. Okay, even vagal stimulation. As we know, the vagal stimulation is connected with the ECL, that is enterochromaffin cell. So whenever there is a vagal stimulation, the gastrin as well as the muscarinic receptor, I hope you know about the diagram, so I will take quickly towards the diagram. So here. So yeah, here you can see we are talking about this one. So this histamine release. So they will going to inhibit these H2 receptors. So because of that, histamine will get increased. So in this area, if histamine level will get increased, this receptor will also get inhibited. Okay, so what is the role of this receptor? To increase the histamine. So if that receptors get blocked, the histamine concentration will remain over here, and which will going to block this receptor. Okay, so they are also stopping this vagal stimulated histamine release. Okay, so after this, you can see all phases are get suppressed. So what are the phases of acid secretion? So you know about the different phases of the digestion, right? Are you able to recall what are the phases of the digestion? Here some given. Okay, you heard about cephalic phase, gastric phase, and intestinal phase. Okay, you already studied about these phases in the digestion. Okay, that is anatomy physiology part. Okay, so this drug particularly acts in all phases of the digestion, and they will suppress the acid production in all the phases. Okay, and then very effective in inhibiting the nocturnal acid. Okay, so here, what is the reason behind that? The nocturnal acid production largely depends upon the histamine. So that's why in the inhibiting the nocturnal acid, they are very important, or we can say they are very effective in the nocturnal acid production. But you can see meal stimulated acid production have the modest effect. Why? Reason the meal stimulated things have other involvement also, like gastrin, acetylcholine. So that's why we can able to see around 70% of the acid production will get inhibited. Next 30% in which this gastrin and acetylcholine is involved. Okay, so apart from that, we can see what are the effects with the gastrin secretion. Volume will get decreased. Even pepsin release will also get decreased with the H2 blocker. Even the intrinsic factor, if you know about the intrinsic factor, vitamin B12 intrinsic factor, which also get released from the stomach, and the parietal cell is responsible for the release of the intrinsic factor too. Okay, so here the intrinsic factor will get decreased, but as such, as we know, vitamin B12 is required in very less quantity. So that's why we are not able to see any vitamin B12 deficiency with this H2 antagonist. Okay. Again, he can, that is the same thing, reduce 60 to 70% of the acid, and anti-ulcerogenic effect they are showing. No effect on the motility. So they don't have any effect on the smooth muscle, even GI smooth muscle or any smooth muscle. So that is all about the pharmacological action, H2 blockage property they are having, and effect on the gastric secretion. So what important thing you need to note it over here? Here you need to note this one, inhibiting the nocturnal acid and the modest impact on the meal stimulated acid secretion and volume reduced by 60 to 70%. Next one, pharmacokinetic. So in the pharmacokinetic about this cimentidine, like you can see, bioavailability is 60 to 70%. Again, the another drug from this category is nizatidine, also very recent drug, and it have bioavailability about the 90%. No interference with the food. Okay, so you can take before the meal or after the meal, no problem. There are few drugs from this category like proton pump inhibitor. It should be taken 1 hour before the meal. Okay, so with these drugs, there is no problem with the absorption, because what happens whenever we'll take the proton pump inhibitor with the meal, there is a less absorption of the proton pump inhibitor takes place. Okay, so that is what the reason to mention this point here. Again, crosses the placenta, so it should be avoided in the pregnant woman. Again, cannot cross the blood-brain barrier. Okay, so that is an important property. They are not able to cross the blood-brain barrier, so no effect related to the CNS. Metabolism, they have few interaction, drug-drug interaction. How? By they inhibit some cytochrome enzymes. So because of that, few drugs have some problem because of this drug. Again, increase the toxicity of certain drug because of this reason. Okay. Then next one, this is about the cimentidine, but next generation drug have few interaction. Okay, we are not saying that complete stoppage of this drug-drug interaction, but there is few less amount of drug-drug interaction with next generation. Elimination by kidney, 2/3 of drug excreted unchanged. T-half is around 2 to 3 hours. Oxidized metabolite. Okay, so in the excretion you are able to see oxidized metabolite of this cimentidine. Okay, now we're going to talk about the adverse effects. So as such, it is extremely safe drug and well tolerated, but there are a few problems with this drug on long-term use, or we can say at the high doses. At the normal dose, or we can say at the normal use, you are able to see few side effects like headache, dizziness, bowel upset, rashes, dry mouth. Okay, so these are the few adverse effects noted with the H2 antagonist. And with the long-term use, you can able to see anti-androgenic effect. Okay, so even prolactin secretion get increased, estradiol metabolism get affected, like inhibit the degradation of the estradiol. Next, at the high doses, they have various other effects related to the hormones like gynecomastia, loss of libido, impotence, even the sperm count will also get decreased. Okay, so these are the effect we are able to see at the high doses for long time. Okay, so that's why adverse effects are there on long-term uses. Here, decrease in the intrinsic factor is there, but as such, vitamin B12 deficiency do not occur. Should be avoided in the pregnancy and lactation. Reason, they crosses the placenta. Okay, then next about the drug interaction. We already discussed about it have drug interaction. So which drugs get affected? Like in presence of antacid, this drug absorption will get decreased. So antacid and the this H2 antagonist should not be given together, because the pH will going to hamper, and that pH change will cause the decrease in the absorption. Next one, cimentidine is also inhibitor of the various cytochrome enzymes. That is what the reason why they are showing the toxicity with the other drug. So because of this inhibition of these enzymes, which are important for the metabolism of the various drugs. Okay, you can see various drugs, their metabolism depends upon these enzymes. So if that enzymes get inhibited, the this level of the drug will get increased, so it can be toxic. Okay, so dose reduction should be there if these drugs are given with the cimetidine. Then next one, ketoconazole. Okay, so H2 blocker will cause the decrease in the acidity, and ketoconazole absorption will get decreased because ketoconazole require the acidic environment for the absorption. So if they are decreasing the acidity, their absorption will also get decreased. So these are the few drug interaction with the H2 antagonist. Okay, so uses of the H2 antagonist. So here you can see the timeline given below. So this is the first drug from this category, and you can see there are the various other drugs are there and under this category with less side effects and less drug-drug interaction. Okay, so here where we can use this H2 antagonist in the gastric ulcer, in the Zollinger-Ellison syndrome. So what is this Zollinger-Ellison syndrome? Anyone knows? Yes. Have you heard about this word? We have seen that video. It is very much clear what is this Zollinger-Ellison syndrome.
Gastric tumor.
Yes, gastric tumor, or we can say this tumor will going to secrete the gastrin tumor. Okay, and as you know, gastrin is also involved in the acid secretion. Okay, so stress-related ulcers, duodenal ulcer, even gastroesophageal reflux disease. So these are the